So it's been my great honour to present the data from Myeloma XI on the Revlimid maintenance data from the trial. This was a large trial. We randomised over 1,900 patients to the question of whether Revlimid maintenance could help patients in terms of progression-free survival and overall survival. It was a trial that looked at that question in the transplant eligible and the transplant ineligible patients. We randomised the transplant eligible patients 100 days after the transplant and the transplant ineligible patients at the end of frontline therapy. Patients were randomised to either get observation or in the active treatment arm they had 10 milligrams a day of Revlimid for 1 to 21 days out of a 28-day cycle. We've presented the data in terms of progression-free survival. Our data shows there is a very significant advantage to Revlimid maintenance in terms of progression-free survival, both in the transplant eligible patients and in the transplant ineligible patients. The progression-free survival advantage for the transplant eligible patients is around about 27 months with a hazard ratio of 0.48. For the transplant ineligible patients, the improvement in PFS is 15 months, again with a very good hazard ratio. For the transplant eligible patients, our data really marries well with the meta-analysis that was presented last year and published in the New England Journal of Medicine. Further on, we've looked at overall survival, and the news we also were able to present at this Congress was that there is a survival advantage, particularly for the transplant eligible population. So at 3 years, the overall survival for the observation arm is around about 80%, but for those patients who received Revlimid maintenance, the overall survival was 88%, so a very significant advantage with a hazard ratio of 0.7. So clearly showing that that PFS advantage translates into an overall survival advantage.